We are now at the EHA 2018 meeting in Stockholm, and I would like to speak a bit about the pipeline, a new pipeline in multiple myeloma. So we know that in the last 10 years we have seen a great improvement in the treatment of multiple myeloma patients with the introduction of many novel agents and combination in all stages of the disease. However, we still need novel drugs for these patients that relapse to the novel combinations we have. And for that reason, we have several options. One of them is obviously immunotherapy, and we are seeing here in this meeting and in some other ones, in many sessions and even abstracts, that we have some immunotherapeutic approaches, such as antibody-drug conjugates. We also have bispecific antibodies or bispecific T engagers, and of course, CAR T cells that are a great success or a great promise now in multiple myeloma as well as other hematological diseases. But also there are some other interesting mechanisms. For instance, we have the anti-CD38 monoclonal antibodies. We already had, of course, daratumumab approved, but we have some other ones. For instance, isatuximab. We are seeing here data of isatuximab in combination with pomalidomide dexamethasone with promising data. And also we have another anti-CD38, which is MOR 202 in combination alone or in combination with IMiDs, also with good results to date. We also have a good drug, which is a novel alkylator, which is melflufen, that in patients that were previously refractory to daratumumab or to pomalidomide, they have demonstrated around 30% responses. I think this is also a good partner, a good candidate for the treatment of these patients, alone or in combination. We will see the new combinations. And also I want to mention a couple of abstracts or papers we are presenting here. One is about the simultaneous targeting of two anti-apoptotic proteins. One is, we know the activity of venetoclax in myeloma, particularly in patients with translocation 11-14. But we also know that the overexpression of MCL1 could be a mechanism of resistance. So what we have done in the lab is to simultaneously target BCL2 with venetoclax and MCL1 with a novel inhibitor, S63845 from Novartis or Servier. And we have seen a great synergy in vitro, ex vivo, and in vivo, and we have demonstrated this mechanism. I think this could be interesting in the future. And the other one is that targeting of MYC. MYC have been demonstrated to be overexpressed in myeloma, particularly in the relapsed situation. And we have tested a new, there are no many MYC inhibitors in the clinics, and we have tested a new peptidomimetic targeting MYC with also good data preclinically and in vitro, ex vivo, and also in vivo. I think the main point here is that we have many novel agents which are quite interesting, and hopefully we could in the next 10 years advance as much as we have advanced in the previous 10 years with all the new drugs we had.